So, hi all, Dr. Isha this side, your TTC companion, and in this episode, we will be discussing a topic which is need of the hour in today's world: conception after 35. This is not just a statement, it gives power to women who want to own their fertility outcomes. Women should not feel paranoid about aging. Instead, expert opinions, knowledge, and resources can help them make informed decisions, driving confidence and clarity in their TTC journey. So, joining me in this discussion is Dr. Chandini Chinta. She is an experienced IVF and infertility specialist who has served in renowned fertility centers in Vijayawada and Hyderabad. She excels in handling all kind of infertility cases and follows an evidence-based, protocol-led approach with international standards. An IVF and endometriosis patient herself, she is known for her empathy, patient friendliness, and communication skills. Now, I would like Dr. Chandani to briefly introduce herself before we start the session.
Hi everyone. So a little about my educational background. I've done my undergrad from Kolar, SUMC College. Then I moved on to do my PG, that is MS OBG from JJMC Medical College, Davangere, where I was a university topper. Then followed by a fellowship in IVF and fertility. So this is in short about my educational background. I believe in educating couples about fertility so that they can make an informed choice. And I also want to remove the stigma around infertility, which I try to do with my social media handles. Please do follow me on Instagram. It's Dr. Chandini Chinta.
Thank you for joining us, Dr. Chandni. I am determined that with your experience and immense knowledge, we are going to have a really interesting discussion today. So, let me
Thank you.
start with my first question. So, how
Yeah.
can women over 35 assess their fertility? What are the key diagnostic tests that you would recommend?
Yes. So for at the onset, I would like to say that fertility is not always about age. It's about understanding your body no matter at what age you are.
Right.
Having said that, there are a few simple tests which will help you understand where you stand. So these are starting with the blood test. One of them is AMH. It is like a snapshot of your ovaries. It tells you how many eggs you have left with.
Right.
Next is female reproductive hormones like FSH and LH. So when these are offset, your ovulation might be hampered. So these also give us a clue about the ovulation.
Hmm.
Moving on, next would be looking for the AFC in your ultrasound scans. AFC is nothing but the number of follicles which you can see in the scan. So this kind of correlates with your AMH, but in a few patients, we do see that the AMH and the AFC are not correlating. Then thyroid, prolactin, these are the basic hormones which need to be in order for your reproduction and for your fertility for your fertility to be good. Also, I would like to highlight that women over 35 only concentrate on themselves,
Hmm.
as do so many other doctors. But I would also like to say that testing the semen of the partner is very important.
Right. So, as you were mentioning about these tests, you also mentioned that sometimes there are certain patients for them AMH and AFC do not correlate, right? So, at that time, what do you consider as a better diagnostic parameter? Is it AFC or is it AMH?
I would definitely say it's the AFC, that is the number of follicles we see in the scan. But
Right.
because these are which have the capability to respond to the injections and tablets we give. So
Hmm.
these are the ones which ultimately grow and we can follow up in scans. So we
Right.
need to believe what we see, right?
Yeah.
So I have seen in experience that the AFC is what really correlates with the number of eggs they finally get in IVF.
So if someone, who has a low AMH, she shouldn't feel like scared because she should, go for a next step and get her AFC checked or maybe, her FSH levels also just to make sure that her ovarian reserve is fine or is it depleting, right?
Exactly.
Okay.
Yes, yes. So AMH, I also would like to say that AMH does not tell you how fertile you are. That means even people with low AMH have a capability of getting pregnant naturally.
Right.
So to compound the low AMH, I would definitely suggest go for an AFC test
Hmm.
to look at the number of follicles you have. Also,
Mm-hmm.
the FSH will kind of give an indirect marker about where your ovary stands in
Okay.
kind of in terms of So
Right.
keeping all this in mind, we can take our informed choice
Hmm.
about what has to be done next. Or definitely have to jump into higher treatments.
Yeah, right. And does
If that
AMH,
is, yeah.
sorry?
Is that what you're asking me about? That,
Yes, yes.
it's not that, yeah.
Absolutely, absolutely. And just one question lastly about the AMH part, that does AMH also, give you an indication about the quality of the egg?
No, AMH does not give you an indication about the quality of the egg.
Hmm.
Even people with very low AMH have very good quality, few
Okay.
people.
Hmm.
So they do have good prognosis
Right.
ultimately.
Hmm.
So AMH is only, like I want to reiterate this, it's only an indicator of the number and not the quality.
Understood.
Quality one can never really tell just through scans and blood tests.
Hmm.
See, the ultimate proof of your quality would be having a live birth. Will be having a baby, because that
Hmm.
is what we are looking at the end of this, right? We want a live baby. So
Right.
even if your AMH is less and you have had a baby naturally or through treatments, that means you have good quality. So
Hmm.
in scans or blood tests, we can't tell the quality. The
Hmm.
only way we can tell the quality is, like I said, when you already have had birth,
Hmm.
or in IVF when we remove the ovarian fluid,
Hmm.
the
Hmm.
fluid from the follicles, and we give to the embryologist. That is when he looks at them under a high power microscope to determine the quality of the eggs.
Okay, great. So, yeah, that was about the first question. Now let's talk about our second question. So, what are the risks of waiting until 35 to conceive, and how can these risks be managed?
Yes, so this is a very common question I get asked.
Hmm.
But I would also like to say that it does not, 30 or more than 35 does not mean you're very late. It
Hmm.
only means that you need to be a little proactive,
Yeah.
understand where your fertility stands and what it means for the future. So
Hmm.
don't get alarmed. It does not mean you're late. It just means you need to get moving from now on.
Right.
Okay, so the first and foremost important point I think many of us are aware about is, as the age progresses, the number comes down and
Hmm.
so does quality. And
Yeah.
because of, when they do try for pregnancy, they find it difficult to get pregnant. One, because the number of healthier eggs is less.
Yeah.
Two, if they do fall pregnant, they might have increased chances of chromosomal abnormalities in the babies, like Down syndrome,
Hmm.
or they might end up in
Yeah.
So next, after that is, as you keep aging, your medical conditions might get, worsened, or they might kick in. Like few people might develop diabetes or fibroids in the uterus,
Right.
or few people develop hypertension,
Hmm.
which might hamper the course of pregnancy. And if actually we're talking about, fibroids which are big
Hmm.
and pressing on the endometrial cavity, they might also hamper with getting pregnant.
Yeah.
Yeah, so that is why we say, as the age, increases, one, falling pregnant will be difficult.
Hmm.
Two, you might have two issues in the babies which are born, or
Hmm.
they might have miscarriages.
Right, right. So it's mainly the quality of the egg or sperm that gets compromised with age, and it's not just about the woman part, it's also the male partner, right?
Yeah, yeah, it's also about the male partner. Even in the male partners, this happens, but more so in women,
Hmm.
especially after 35.
Hmm.
From
Hmm.
30, the decline starts. The decline is rapid, they say, after 35.
Right.
In men, it is more so after years. But having said this, I wouldn't say, all these are one size fit all. Every person is different. I
Yes.
have seen women who are more than 35 who have good reserve.
Hmm. Hmm. Yes.
Okay, so like I don't panic. Just meet a specialist, take some guidance, see
Hmm.
where you stand, understand, how these might progress. A
Hmm.
regular fertility checkup might help in such conditions. And
Absolutely.
also, if we are planning, if you do want to delay this, process, then you think about egg freezing or embryo freezing, because you'll be freezing them at a younger age. But
Hmm.
if already you have started journey, then maybe doing some testing early on, detect any problem. Like if you're already pregnant,
Hmm.
doing some tests in pregnancy, we call these first trimester screening tests.
Hmm. Hmm.
So these are certain blood tests done in the mother. So these also help in detecting the chromosomal abnormalities. And
Right.
definitely, before you get And if you want to be careful, then doing genetic testing using IVF services is one of the methods to, kind of not fall into these complications.
That makes sense. And because now you were also talking a bit about egg freezing indicator, you were giving an indication towards egg freezing. So I also want to, know from you, do you also recommend egg freezing or fertility preservation in early 30s or mid 30s? What is the right age to get, eggs freezed?
So, what I would like to say is, I've also seen in my experience that patients who are in their early 30s
Hmm.
and want to delay starting their family, or say they're not married and they're not ready to settle down as yet, could be for various reasons, could be career, personal, they've
Hmm.
not found the right person. I
Right.
would say egg freezing is a very viable option,
Hmm.
because in egg freezing or IVF, it's all about doing it earlier. If
Hmm.
we do it earlier, what happens is you have younger eggs or younger embryos frozen.
Hmm. Hmm.
So with these, when they're younger, first you have the benefit of number.
Hmm.
Two, you have the benefit of healthier eggs. So
Okay.
you're not preserving something which is already bad.
Hmm.
So, freezing in mid to late 30s is always a very good option if you know that you're not going to be settling down anytime soon. And but having said that, few patients might not be ready for this,
Hmm.
because IVF does have hormonal injections, right?
Hmm.
So few patients might not like the concept of taking too many injections, or few patients do have some side effects to those,
Yeah.
because few are sensitive. Though not major, they find these bloating, the minor side effects they have, they find it a little, offsetting to start these things. So I think when you're in doubt, talk to your specialist,
Hmm.
reach out to them, see where you stand, and then make an informed decision.
Right. So any center like IVF center, so sorry?
I would say freedom is like taking hold of your future.
Hmm.
Like, you don't have that pressure on your mind that, your biological clock is ticking. You don't have this pressure from your family and all that, you're getting older, you need to
Right.
start a family, getting married, and even career-wise.
Hmm.
So all this way, it's like taking hold of your future and having a backup plan. So it doesn't mean that if you freeze your eggs, you need to go for IVF.
Hmm. Absolutely.
So you might fall pregnant naturally, but you're having this backup plan. So in the future, you're more stress-free while trying also.
Right, right. That's true. So as you
Yeah.
were talking about egg freezing, so any IVF center we can go and, and ask for egg freezing if anyone is willing to do for the same.
See, the place I work at, we do egg freezing, it's a very common thing for us.
Hmm.
It is nothing very different from IVF.
Okay.
The first part is the same. We are stimulating the ovaries
Hmm.
to get the eggs. So
Hmm.
that is why I'm saying do it earlier. I know earlier as possible if you are in your mid or late 30s,
Hmm.
because you want younger eggs. So
Right.
you're stimulating the ovaries to get the eggs, and then
Hmm.
we retrieve the fluid and give it to the embryologist. So they check the quality and freeze it.
Right,
So
right.
the first bit, same in IVF also, and egg freezing also. So I think any IVF center should be able to do it.
Okay. Okay. That's nice.
I would also like to say that egg freezing is not only for women who are, in their mid or late 30s. Few patients with medical conditions which might make it difficult for them to get pregnant later can
Right,
also freeze their eggs,
right, right. Right.
right? For like cancer patients, or they have endometriosis.
Yeah.
Like I was a patient with endometriosis, but back then no one told me that I should freeze my eggs before going for the surgery. So I
Hmm.
went for the surgery, and my AMH had fallen down drastically.
Hmm.
I
Hmm.
wish I had known this before. So, that's why I want patients to be, more aware about this, that there is an option where you can save your eggs if you
Yeah.
think they're going to be damaged.
Right.
So, for such patients, though, you need good expertise. Like you should know when to start, what
Yes.
kind of protocol to use, and, so other things. So, definitely going to an experienced doctor or someone who knows this will definitely make a difference.
Yeah, so that is the whole intent of having this session with you, doctor, because that will help our patients to make informed decisions, right?
Right, right.
Yeah. And what I think, what I have heard, and in my other sessions also, that if a couple, who wants to delay their pregnancy, then embryo freezing is better than egg freezing. Is that what you have
Right.
also seen in your practice?
Yeah, I'm glad you brought that up.
Hmm.
So the difference I'll tell you right now is between eggs and embryos. Embryos are more sturdy.
Right.
See, when we freeze them and
Hmm.
when we thaw them, that means when it is time to use them, we get them to room temperature.
Hmm.
So when we do that, there is a tendency, suppose I froze 10 eggs,
Hmm.
maybe 8 eggs will survive that procedure of thawing and be good when you're actually up to using them.
Right.
Whereas the 100% of them survive. The survival is better for the embryos.
Hmm. Hmm.
If you are married at the point of freezing,
Hmm.
better you go for embryo freezing rather than an egg freezing. But if you're not married, then please go ahead for egg freezing because it is 99%, if not 100%, even for oocyte freezing.
Okay. Okay. Makes sense.
The
Now,
modern techniques have made it possible that way.
yeah.
See, another thing I like to tell Dr. Isha, I know I didn't mention we were talking about, mid 30s and late 30s.
Yeah.
See, egg freezing, it has to be done only for patients who are 30 or 35.
Hmm.
Okay, it can be done for anyone for who AMH is less.
Yeah.
And
That's
we know as the age progresses that AMH will come down even more. So for
yes.
anyone, AMH is less than what it is supposed to be,
Hmm.
and they want to be more stress-free and more secure in the future, then I
Hmm.
would suggest egg freezing or oocyte freezing for them.
Okay, makes sense. Now we'll move to the next question. When should women over 35 years consider meeting a fertility specialist? There have been studies I know that say, if you have been trying actively for 6 months and you haven't got any results, then it's time to see the fertility specialist. What are your thoughts on this one?
That is absolutely right. So I would say earlier the better,
Hmm.
but according to the papers, like you said, also according to the research that is there,
Hmm.
they say that if you've been trying for 6 months, which means you should not have used contraception,
Right.
and you should not be using contraception, and it doesn't definitely have to be that we didn't try in the ovulation phase, so that does not count. No, it's
Yes.
not like that. Six
Yes.
months you've not used contraception, that counts.
Hmm.
And you've not gotten pregnant, then I think you should meet a fertility specialist. See,
Hmm.
it doesn't mean that if you meet them, you'll immediately jump into IVF.
Right.
It's as soon as you meet them, you'll be asked to go for the treatment. You
Hmm.
just to understand where just to understand where you are at in terms of your fertility.
Hmm.
So, few basic tests, few minor tweaks, a few minor tweaks, some supplements, a little guidance will help them get pregnant faster.
Yeah.
Because, like I said, after 35, the decline is faster, right, in the egg number. And
Hmm.
also, forget the number, the quality declines. I have seen patients after 35, I told you they have good number, right? But
Hmm.
when we do start treatments, their response is not as much as it would be in a patient who's 28, or 25.
Okay.
So that is also an indirect, indicator of your quality if they're not responding the same way. So
Right.
that is why the 6 months meet with a specialist. And with lifestyle, there are so many things now. It could be like minor things like giving supplements or lifestyle changes or just letting them know when ovulation has happened,
Hmm.
because sometimes they miss the window. Even through apps and even through symptoms, they miss
Right.
the window. So a simple scan to check ovulation and ask them to meet at the right time
Hmm.
helps.
Yeah.
So taking, I think, up months is a good thing.
Hmm. Hmm. I agree. Okay. Now that brings to my last question for you, Dr. Chandani. What would you say to women in their late 30s who feel discouraged or anxious about getting pregnant?
Yeah, I think, if women are getting anxious and discouraged, I would like them to know, first of all, that you're not alone. It is very common
Right.
with all this biological clock ticking and pressure from your parents or your husband, your family. It is a very common thing for women to feel that way nowadays. You're not alone. Take the proper guidance, a little support will help you, decide where you stand and what you need to do. It does not mean that you need to jump into treatments or do something, but
Hmm.
just understanding where you stand will give you a little bit of peace
Hmm.
and make it easier for you in the future. Because see, although they are late, they would want to become mothers, right? I think
Yeah.
all women actually have that thing of wanting to be a mother, wanting to be loved and give that love out.
Ab-
So I think you're not in the wrong if you're anxious, but you don't need to be. You
Hmm.
just do tests, meet the right specialist, get some guidance, and
Hmm.
see what has to be done. Other than this, I would say, like I already mentioned, the few tests, right?
Yeah.
So get those tests done and do some lifestyle changes because lifestyle does have an impact on your egg quality, if not the number.
Absolutely.
And if possible, and if it is the right thing to do, get your eggs frozen because that will give you a peace of mind and definitely an edge when you're trying to start your family later.
I echo with what all you have said, Dr. Chandani. And I think having more control over your body, after you're 30 is what give you a power in this whole journey, right?
Yeah.
And one thing I want to also understand with you as you are a fertility specialist, infertility specialist, and also, you have been doing IVF procedures. So you have also undergone IVF, right?
Yeah.
There is always a stigma associated with IVF. Can you talk about your
Yes.
journey? How was it? Were you also initially being a gynecologist yourself? Were you also like bit hesitant about going for IVF, or were you open to that? Tell me about your journey a bit.
So, my journey, it all started with me having severe endometriosis.
Hmm.
It was so bad that I would faint of the pain. So
Hmm.
then I had to undergo the surgery, and I was, nowhere planning to have kids back then because I was still continuing my, studies.
Yeah.
But with the surgery, AMH had come down a lot.
Hmm.
And also, forget AMH, endometriosis affects your fertility in a way that, every organ, every part of your, reproductive system tends to function less. They're
Hmm.
malfunctioning, basically.
Yeah.
So fertility becomes a challenge, subfertility. So keeping all this in mind, I thought I would, take a break from studies and finish this off because this seemed like a priority to me then.
Yes.
So because if I waited even more, I don't think I could have done it. I don't think I would have been my eggs would have been good enough for IVF. Maybe I would be left with no eggs.
Hmm.
So I had started that. I gave it a good thought and made it a priority, and we went on to start the treatments. So
Hmm.
initially I started off with a simple treatment called IUI,
Okay.
but that ended up with miscarriage. And then I thought my AMH was very less. In fact, it was 0.5.
Hmm.
So, you know, we read about it. Then we met our friend who had done my IVF. And then she told me, you can think about it because we have done IUI and, it ended in a miscarriage. Maybe the quality is less because when the quality is less, you do have miscarriages.
Right.
And, you faster results. And I thought, if not now, I might not stand any chance in the future.
Hmm.
So that is why I went on to do my IVF, and I was very lucky that I had only three eggs. All three of them grew,
Hmm.
and all three of them turned into embryos, which were okay quality, which is not the greatest of quality.
Okay.
But I, a lot of lifestyle changes prior to this IVF, and as soon as I got diagnosed with endometriosis, I
Hmm.
changed my diet, my exercise, and stress,
Yeah.
yoga, and all that. And when I did go for IVF. The first attempt itself was very successful,
Great.
and I don't have twins now from that IVF.
Hmm.
So, I've never kept it a secret. In fact, on my Instagram page also you can see that.
Yeah.
And I've told my family knows, I keep sharing this story with my patients because what is wrong in doing IVF? I don't understand because you're using your own eggs, your own
Yeah.
sperm. You're
Yeah.
just facilitating the process. You're combining the sperm and the egg to make an embryo, which is put back into my uterus, and I'm carrying the baby. So just
Right.
to that point of making the embryo, we are facilitating. After that is happening naturally.
Yeah.
No one can force the embryo to stick to your uterus. It will happen only if it has to happen.
Right. That's true.
Having that quality does matter. It
Hmm.
matters. Quality matters. You need to have a good quality embryo and, at least a decent quality embryo and
Hmm.
a good bed that is your uterus. But even with the, best embryo and the best uterus, implantation might not happen.
Hmm.
But, for me, it happened. So what I'm trying to say is ultimately, if you look at it, it is happening only if you're destined to, have it pregnant that month you
Right.
know so I feel there's absolutely no reason why you should be ashamed of it. You
Hmm.
know, if not for IVF, I don't think I'd been a mother. I count my blessings every day, and I'm so thankful for this,
Yeah.
science which has made it possible. And that is why when patients are hesitant or, they feel a little sad that they're going for it, I ask them to cheer up. We're like, see, you're going to be a mother at the end of this. It's going to be a very short journey. So
Right.
be happy and positive and accepting of it. And
Hmm.
that is why I talk about it a lot so that, patients accept it. Not only patients, society in large has to accept it. It is nothing abnormal. Think
Yeah.
of it like if you take a kidney, right? Kidney transplant.
Yes, that's right.
It's the same.
Yeah. So thank you so much, Dr. Chandani. I think it was an honor to have you here, especially talking about your journey so openly with all of us. I think it will inspire many women, and I'm sure it's going to break the shackles of, having that stigma of IVF. I am also determined that this discussion will change the lives of many women who will listen to this interview. Now, before we end, I would like you to say some concluding words for your audience.
So what I would like to say is whichever journey, I mean, whichever part of the journey you're in, maybe you're just thinking about it, have just started it, or already have been going through it, just you're not alone.
Hmm.
And this is something which is happening, but silently among many couples.
Right.
And seeking the right care and guidance will make a world of difference. It could be a small minor change, or it could be some treatment,
Hmm.
but you're not alone. A path is a little different, but there is always light at the end of the tunnel, is what I believe. And you need to have that hope and keep moving on.
Yeah.
And, I'm always there for you to reach out to me if in case you need any help.
That's great. So thank you so much everyone for joining us for this session. I'm going to add the contact details and the hospital address of Dr. Chandni where she is currently giving patient consultations. And I hope this webinar and this session was useful for you and wishing you all the best for your fertility journey and have a great day. Thank you so much.